I am Dr. Babu Reddy, consultant cardiologist at Narayana Hospital at HSR branch. So, I want to share an important case. So, we had recently come across a 69 or 9-year-old gentleman who is a long standing diabetic and hypertensive, who presented to us with a typical history of chest pain on walking for a few steps. So, that is we call in medical terms as a class 3 angina. So, this prompted us to investigate with routine investigations like ECG and echo, which is a heart scan. So, which showed there is evidence of there is some blood flow to the heart has decreased. So, which also we investigated with an angiogram. Angiogram showed two major blockages, that is around 50 to 60% with lot of calcium deposited in that blockages. So, this to how to go about, because patient's complaints were severe, but the blockage was not that much severe, it is the intermediate lesion. So, for this intermediate lesions, to assess how the blood flow inside the blood vessel, there are tools to investigate. We call it as fractional flow reserve. What this device will do, it is a wire based device, which will investigate the flow of the blood inside, the pressure difference between the blockages, whether distally and proximally. If there is a pressure difference of around 0.8 or less, then there is a blockage is very significant, as what we see in angiogram. It is a two-dimensional view of the blockage, whereas the functional and how the blood is flowing is not been shown in the angiogram. That is the reason why we do this special test called fractional flow reserve. The fractional flow reserve will guide us whether the lesion is definitely significant or not. In our case, the fractional flow reserve was less than 0.6. That means, so the blood flow during an exertion or during an activity, the blood flow has to be increased across the blood vessel, but in this case, if it is less than 0.8, in our case it was 0.6, that means it is a very significant blockage. So, angiographically we thought it is around 50 to 60% blockage, that is a two-dimensional two-dimensional view of a block. So, whereas fractional flow reserve will give us a functional physiological difference between the blood flow between the distal area and the proximal area. So, that is very important for us to decision making, and we studied this block further with a optical coherence tomography. What is OCT or optical tomography? This is a three-dimensional view of a blood vessel which can be studied. We can see it is a camera inside the blood vessel. So, that means we can see all the three-dimensional view of a the blockage and see the content of the blockage, whether the blockage is made up of only cholesterol, whether it is made up of calcium, whether it is only fibrosis. So, how much distance the blockage is there, what is the length of the blockage, and what type of devices we can use to correct these blockages can be assessed with optical coherence tomography, that is called as OCT as a common medical term. This is also a wire based test. We will have a camera and the wire, tip of the wire, which will be connected to a tool which can show us in a computer, which can see either three-dimensional, either lengthwise or also in the cross sectional area of the blockage. So, that will guide us to use what type of balloon we can use, what type of debulking devices to remove the calcium, cholesterol and fibrosis appropriately and treat the blockages very well. So, after studying with these two devices, that is FFR, that is fractional flow reserve, which studies the physiology of the blood flow in the blood vessels of the heart, whereas the OCT gives us anatomical view, that means how much length of the lesion, what is the components of the lesion and what are the ways to treat it. It will guide us all these aspects that made us to treat this patient effectively and debulk the lesion with the appropriate devices, and we have stented this case with the appropriate length of the stent based on the guidance of optical coherence tomography, and we had a very successful result for this case. Patient symptoms appropriately removed with the guidance of these two devices, that is fractional flow reserve and an anatomical view with optical coherence tomography. So, we were able to assess the lesion physiologically with FFR and anatomically with optical coherence tomography, and these two guide this patient to treat effectively and we are able to stent this blockage and remove the blockage, and the blood flow to the heart is restored very well, and patient symptoms effectively reduced. The next day itself, patient was able to feel the difference. Patient symptoms completely gone, and patient is able to walk 2 to 3 kilometers after a few days. So this is the way we have to treat this type of patients, and the latest devices help us to find out the appropriate lesion and what to be treated and how effectively we can treat. Thank you so much.